Jeffrey. I'm inclined to let you go away and not to let any of you ask them any questions unless there's anything pragmatic. So, good. I'm going to keep moving if that's okay with you, because people are going to go and let you get on the road. Is that okay? I think Jeffrey made some really interesting parallels between the need for childcare and home care, the need for early and appropriate intervention, but also the inconsistencies that currently exist across the country. And I think all of that could equally be said for home care. Next up, we have Stephen McMahon. Stephen is Chief Executive of the Irish Patients Association, and again, will be very well known to most of you here, constantly advocating on behalf of patients across the health system in Ireland. He's talking to us today to speak to us about keeping the patient's needs at the centre of home care services.
Thank you to the organisers for this invitation to address you this morning. I'm aware of the time factor, so I'm going to try and just cruise through quickly this whole area of encouraging the importance of the patient. Now, what I would say is to you, if you use service user, client, or whatever other language that resonates with your area, there's no problem, but I just like to use the term patient because to me it has a specific reference. But I know in community care, people may not actually refer to it, so basically, I just want to say that RAs, the Irish Patients Association, have a world-class healthcare system that has the patient at the centre of that. We see ourselves more as advocates, not a lobby group. We don't sort of do the protests in the high street. We like to try and do a bit of homework sometimes to make the case of whatever particular area that we're trying to work on. We were funded by the HSE up to last year, and regretfully we were underfunded from that source. So we've been bouncing around the bottom for the last 6 or 7 months, and hopefully we see these guys in the summertime. What do? We deal directly with patients, some 500 cases per year, who've had a personal experience of the healthcare system. And to be honest, there are often the more adverse events that can happen to folks, and we try and help them and help them navigate the system. And if they don't have the resources to do that, we will journey with them and do the necessary letters and attend meetings and so on and so forth with them. And basically, we also like to work with, in partnership with all the stakeholders to resolve the issues that may actually happen. And I suppose our maxim is that change and reform in the healthcare system must not be preceded by preventative funerals and injury to patients. And we heard reference there this morning to some particular reports into some tragedies that have happened over the past. And sometimes we have this difficulty in the system actually learning from those experiences and effecting change. So we've done, I'm just going to go through here, we have been involved in UCD, Dublin City University, in the Charter of Rights and Responsibilities, in the whole area of reforming Irish patients. And what I would put up in that particular piece is that we talk about information bearers and assessing the person's competencies to understand what it is you're trying to convey to them. And I think that that is just as active in the area of community care as it is in the area of acute hospitals. And indeed, I suppose it will also be a challenge in the area of ambulance area on technology to ensure that people understand what it is that they're trying to do for them. We've had a lot of work in the area of Emma said, and she's spoken about dot on the agenda big time. And the thing about what I just want to say is in the community we've got to be mindful that all healthcare acquired infections aren't just in hospitals, but they're also out there in the community. What are your plans when you're visiting your clients in the community to the point that you're protecting against healthcare acquired infections? So just to briefly just say that to us patients and persons through the entire healthcare system, it's a multi-billion dollar, multi-billion euro industry in Ireland, and there are very many different vested interests, and there's no problem with people being out there in their particular area of offering service and so on. But the real person that's important is patients. That's a really the reason why we're all here. And just be mindful that they are, an explorer in a foreign land, they come across with strange language, customs, indeed costumes, and it can be a very frightening and unsettling journey for them. And indeed too, when somebody requires somebody to reach their home to perform tasks and service and so on to them, that is also a new experience for them to have people coming in that they may or may not know one day to the next, and that can have its own challenges as well too. The needs of patients, as I say, the first we based on our experience now for about 15 years is to be treated with dignity. And I see some people out there that probably heard me quote this old Nigerian proverb that says, no matter how shattered is the spirit shrine, the spirit is there all the same. And I think in your services that your companies and organisations provide, that if your staff and yourselves have that particular value, I believe that you've gone a long way to countering a lot of the problems that we've seen over the years. To have equitable access to service and medications, whether it's universal health insurance or whatever the model is, at the end of the day, we want to ensure that everybody has that equal chance to access our healthcare system. We know that the lowest income groups have the highest instances of respiratory illness and so on and so forth, versus their opposite leaders in the more affluent areas. To be informed, to be told about what their conditions are, the services, the choices they have, so that they can make informed consent. The need for right touch governance. I don't believe in over-governing everything, but that it has the right touch that it will hold and facilitate people to be able to conduct their business and provide services that they have. And I believe that HICWA has done a tremendous job in actually starting that whole process. And I think that it's not a question of when it's going to happen in the home care industry. It just wouldn't matter when it's all going to come together and to be ready now rather than to wait for it. And when things go wrong, to make a complaint, that it's okay. Like there was a case there recently of someone that was from a nursing home that were in the 2 hospital system. They weren't happy with the nursing home. And we arranged for a social worker to visit them to hopefully they would be able to convey what the concerns were. And the social worker came back and said, oh, it's great, the person's delighted, for this thing. And when we contacted the person saying, well, what you didn't say to the social worker what you said to us. And they said, oh, I didn't want to rock the boat. So again, that's something that's so mindful of when you're out there in the field. When things go wrong, to be informed. If something isn't done right, to have this open disclosure that you've made a mistake, if something didn't happen, so that there's that relationship building. And just to go on here, basically, I think the present and future patients need to trust the system. And whether that system is in the acute hospital system, the primary care sector, or out there in the community with future services, at the end of the day, both they and their families want to be able to trust the people that are taken care of. Just a quick comment on patient-centered care, and I'd ask you when you're planning your plans into building the strategies for the coming year, and that this started from using that for about 10 years, and I still think we have a lot of work to do on it. But there are principles of patient-centered care, so don't just use the buzzword. It means access to healthcare services warranted by their condition. It means information that's appropriate, relevant, and timely. It's about empowerment and motivation of patients to take responsibility for their healthcare and to be as independent as possible with patients' organisations and so on to be recognised. These are the principles that are set down by the International Alliance of Patients' Organisations. I was on this board and we presented to the UN NGO Health Committee some years ago to give real sort of strength to the patient's voice in there. And again, involving patients and patient representatives in all decision making. So these are going to be challenges we need to embark out in this process. I'm not going to just say that we know that our healthcare system is under pressure and it's got problems with the funding. But I just want to throw this part out there that we've heard this morning that the 65 plus, I reckon, are going to go up by about 86% in the next 20 years versus 20 years. And that's going to create its own challenges. Now, I just want to make a quick comment from this on the OECD report, right? And it talks about the future health strategy in 2013. It says long-term care really aims at making the current condition of the well of their individuals leave long-term care due to disability, chronic condition, trauma, or illness, which limits their ability to carry out basic self-care personal tasks that must be performed each day. Another difference in savings between spending on health and long-term care is that the cost of helping a dependent person is more or less the same in respect to the age. However, moreover, while potentially the entire population will benefit from healthcare, only dependent persons will be directly benefited from long-term care. And what I'm trying to do here, and you've got some of this also might see in the expansion, is to separate the concept that this is healthcare. It's actually about long-term care, which requires its own form of budgetary control and will grow as we see it go forward. So let's just get towards the end here. I don't know how much time, but I'm very close there. Thank you very much. What I was just trying to do here was to just sort of the patients that are person-centered home care services. And there's sort of, it's not a checklist at all, but they sort of are just reflecting some of the things we've come across over the last 12 months. The importance for records, the medical records, their recreation, the needs that they have for physiotherapy and neuropathy and all the other sort of services. You may have noticed last week we were out over an issue in one of the nursing homes, and there was not only cycling on the problem that was there was that social activities in nursing homes is not part of the fair deal scheme, which we learned in great detail. And there was a HICWA report recently, or last year, the year before, into nursing home. We walked into the foyer of this nursing home, and up on the wall was the social activities for this home. 11 o'clock mass, 2 o'clock manicure, and 3 o'clock dinner. And that was the social activity for the week in that particular institution. And was there any wonder the lady members at the nursing home tapped the people inspectors on the shoulder and said, actually, this is really serious as well. It's changed to that. The point I'm trying to make is that even out, in the community there, visiting their clients and so on, that social activity is much needed in their particular home, in the spaciousness of their house. They may be confined physically and have certain challenges and so on, but they get their shot. And that's why I like Andy's talk about the team of background analysis. To find ways of technology, baby boomers in 20 years are not going to want what's here today, they're going to want a totally different lifestyle, including this and everything else. So again, I just want to say about the importance of regulation and so on. When you come across an individual who's had a bad experience, or there's been some questions of abuse, or the lack of service and so on, it's soul destroying to know that really, that there are regulations there to protect individuals, but they are, as we just learned before, that they're very vulnerable, and they can be not listened to from the point of view that they might have a problem with a particular carer that's coming to the house, and there can be cultural issues about language, about how they actually interact with the individual, and they're going to be big challenges because again, it's every contact with the patient is how can say is unique and can quickly diminish the trust that's there if somebody gets it wrong, if somebody's hard to concern. So my last message, I suppose, to you all is as part of your organisations is to be a caring presence. It's not whether it's in an acute hospital system, but in their home, that is a value that your staff and yourselves have, is to have that caring presence. It means not just following policies. It's easy to do a checklist of a policy from HICWA or any other quality group or whatever else to say, we adhere to all that. An example I saw recently was in a particular nursing home. They had a schedule in the back of the door which gave the names of the clients in that particular room and what days of the week they had that. Right? And the thing we want to catch was if somebody got 30, the question was, were they only adhere to the program that said, see as bad advice. Yeah? So you can involve procedures and processes there, but you have to be able to look at the wider picture at the same time. And again, I have to say the importance of advocacy. I think the whole area of, about is beginning to emerge to some degree in the acute hospital systems. There are incredible disease-specific groups now that really ramp up their advocacy, in looking at a particular disease group that they're responsible for. But we also have to keep in mind how can we ensure that voice that that client, patient, or whatever term you use, can actually be constructively brought back to your organisation so that you can even improve the service that you're offering even better. And hopefully, by doing a better job, by listening to your clients and so on, and the role of advocacy, you are actually safeguarding your future business interests, but at the same time ensuring that what's being offered there is the best and can be demonstrated as being the best that we can do. So the benefits report, that's my mobile number there. We're always open if anybody has anything to share with us from time to time. We deal with them in confidence and so on. And with that, I just say thank you very much. Thank you.
Okay, 2 minutes before lunch, so I think there is somebody with mic if there are people, right, thank you, with questions. I have a question, if I can, for Andrew, in terms of, I really enjoyed what you were talking about, and you talked about bringing the technology that's in the New Haven Centre into people's own homes, and how you're going to try and bring it down to under €500 to do that. Can you tell us a bit more about that?
I suppose if you look at the whole space of technology and all the other elements, and that's why you asked me about iPhones and Android phones and all this, that whole technology element just defining technologies, anything that would be phones, like security systems, all these other elements, which are already basically most people's homes. Most people have them figured out in their home. That can be turned into daily activity monitoring systems, manage how they get out of bed, and how they sort of mention how they met their home at night time and all those other things. So there's a lot of existing technologies that can be repurposed. And there's a whole wave of newer technologies that can be used. But that needs the other support. Technology is one.
And are there other places or other countries that are doing that as part of health care or social care in people's homes?
Very much so. You know, like this Irish investor, ECH, there's an American system called Lively, rolling down $49, $20 a month for some of the systems. There's providers here today in terms of what that technology is doing. So, you know, you're finding that this is a global challenge. You know, the exact same situation is global, but it is very much about those opportunities, what we do on a basis, and then how does it take out and integrate.
Okay, two women here, questions at the back.
I just wanted to ask you, you mentioned that it's a global issue. To what extent and to what level of patient are you looking at for this type of technology and the level of supervision, and how do you ensure that a person doesn't become isolated in an environment where it's mainly supported by monitoring, supervision, through data, you know, that the person is not, as I say, becoming isolated, but now to encourage other long-term mental illness and so on. So are you supporting that the technology becomes part of the overall picture, facilitating the care process, that those carers, individuals, the family, the support network? How do you avoid this feeling of trying to ask that the person doesn't become, you know, cellular unit where it's just all sensors and monitoring that?
Totally. I have an onion picture up there. We call it an onion picture, but the layers. You have the person at the center, and around those is family, around those is community, around those is public and private services. So, you know, technology is only an enabler within that. It's how to connect. It's how to create a connection between all the other things. Social isolation and all those things are huge in terms of. But one of the, you know, we did iPad classes with some of the older residents, and we do have community programs. Once, you know, we've had older people cry when you Skype and family visiting somewhere. It's the usefulness of the technology and all the other things. And it shouldn't be out there, it should just be three things you talk about: community, environment, and technology. You need those three things together to actually get things. What are the community services? What are the support organizations? What is the environment that somebody's living? How does technology then create connections?
Stephen is going to respond to that as well.
Yeah, thank you. Just want to make a quick comment about it goes back to what we heard others talk about today, about the whole care plan. And it has to be one that's dynamic because the person needs to take and shift. And I would like to think technology is actually feeding whoever it is that's looking after the care plan to say we're actually seeing it for walking through but equally another big one would be the importance of monitoring of the carers who are actually dependent on family. Families, if they have somebody who looked after by carers in the home, they do a plan, say, within 9 o'clock, 12 o'clock, whatever time they do a few times a day. And families then are looking for support and families are building around that. So, the certain one I know that was looking for, service to give back, but actually we did attend 12 o'clock every day, 9 o'clock. Because by the way, that person needs to have a lunch or a tea or a breakfast. And that's why these sort of technologies will actually help protect families.
I just add to that very quickly. So, because we've done lots of interviews with home care providers and all the other things already in terms of and people take on service and they give practice great with sensible people taking on service. Transparency becomes a huge issue on how you want to is the service being delivered physically delivered all the time? And technologies can assist that whole aspect. But it's not the care provider has an aspect on how to provide that to other people that are connected to that care. How to provide it to family, how to provide it to neighbours to make them part of the huge.
Over there, and then the summer comes. If there's anything else.
Again, parental generations who in relationships with healthcare, it's much bigger out there than taking health is at the moment. In relationships, the monitoring somehow, we use everything move forward to have people who's open and sexuality perhaps any health moving on, and also then protect care of such.
Yeah, in fact, we don't do the 24/7, so we have a monitoring set for contract services that monitor the 24/7, so a lot of our nurses have been really care. But we like to see it as 10 plus, now it's becoming telehealth, and it's great that it's all digital, it's very good, instead of all the teleworks. So, yes, telehealth is coming up, but if I'm looking for it to happen, we will see yes, it is happening in specific areas, but it should make sure I know specific work in this case. I'm seeing it, we now see the transitional care, a continuous false project as well in terms of it is not. So, yes, there is health education where so there's a whole question about whether people themselves can take on a lot of this technology and support whether they operate. That's why I say it is not. So there's different companies right now who provide additional services on. So if in case of maybe the hospital, home care provider takes with the biometric units of the older it's the clinician who actually reviewing that remotely and then escalate the requirements. So that would be the action.
It's all about funds
And maybe we can with the Alzheimer's Society, where the home care coordinator in Amsterdam. Just in the Steve was saying there about us all becoming advocates for the people we care for the community. There is no place of safety for the vulnerable adults who are victims of abuse in in the system. And I think it's just an observation on Dr. Jeffrey Shannon was saying, and in child protection, you can take a child into care, but you cannot take a person with dementia into care if it's not produced. And I think we need, as a group of care providers, to campaign to have a place of safety and a system put in place so that we can protect people from the harm to care abuse.
I agree. Not that there's nothing to do, but I agree with that. You know, it's, you know, if everything's working for 95% of people, you know, that's fine. But it's over 5% of got to be focused on should be around.
Thanks, Ed. I have a question for both of the speakers. In terms of the slides that we just saw from Sweden, I was very impressed by the person-centered care slide. And the remarkable fact that we provided that with the network social access management. And if we go to an earlier presentation, we've seen that there's 50 providers out there at the home care centre. Nobody knows what the exact number is. And just wondering from a patient advocacy perspective, have you seen a variance in the type of standards that are developed? Because in my view, there's probably 50 different ways that that service should be presented to the patient. And what would your advice be in terms of dealing with that scenario?
And the answer is in the field. And I have seen a difference in the way that the initial assessments are done, the objectives that are performed when you visit the family where somebody is going to and the issue comes around that how to say it earlier on, the classic checklists of all things that have to check with the relative food, the home members or family members, the local doctor, all this stuff. But what happens then is that the record keeping is meant to be quite it becomes the baseline as opposed to keep things that they have to learn to do in the job and so on. And I think that I would hope that the standards that are set for the industry, for the sector, will really tie down the key things that are important, and importantly, be able to demonstrate that whatever's going in of the service technology, is actually
Yeah, okay. And just so Andrew, I had to change my whole phone recently. I went to the shop and there were 72 different smartphones that I could have picked from. And when you look at the various different stands, we're only looking at a small sample of what's available on the market in terms of technological support for remote monitoring, for, I suppose, alerts. Is there any thing coming down the tracks in that part of the industry that will, advise the purchaser or the consumer in terms of what they should have, what's right to have, what's important to have as well?
There isn't right, like it's very much down to, again, what's available. So in cloud, for example, we have personal. So a good number of people are necessarily part of what they do is try to slice them unavailable technologies and the different protection and that this we recommend so you're going to have to see much more of that to get the point of view so that our other plant-based and only the past are so short and customer reviews and so forth
Okay, I'm going to take no jumping hands as an indication of hunger and the need for a break and lunch. So to thank you all very much for bearing with us through the cold, but also through the really excellent presentation. Thank you for here and not here. To ask you to be back here at 2 o'clock, and I think that this afternoon is more about very sort of hands-on experiences with people, caring for people in the home. And I think Danielle Barron, a colleague of mine from the newspapers, is chairing the afternoon session. So I wish you a very good afternoon. Thank you very much.